Hi, everyone. Welcome, Michelle, to this Facebook Live. Hi, guys.
Hi, everybody.
So we're going to be chatting today about the connection between structure and functional dysfunction and also pain, which is a fantastic topic of Dr. Michele Broadhurst. So while I'm waiting for you guys all to arrive, please give me a thumbs up to let me know if you can hear us and also where you are in the world. And then, Michele, will you please introduce yourself to our viewers?
Sure. So my name is Michele Broadhurst. I am a human and animal chiropractor, also a human acupuncturist and sports physician, and a CCRP. So I have been in the animal field for almost 2 decades, really concentrating on functional and structural dysfunction and how we correct that most efficiently and timeously.
Okay. Hi, everybody. So I want to let you know that we are running a competition today. We are obviously getting really excited for our annual summit, which is on the 14th of November. Michele is one of our lecturers there. So I want to run a competition today. You could win a 1-month membership to Online Pet Health, which includes a ticket to the summit. I need to watch my tongue so I don't slip the name of our summit because that's part of the competition. But so basically all of our Online Pet Health members get free access to the summit every year. So if you win 1 month right now on the 21st of October, you're going to be a member on the 14th of November when we will be holding our summit. So if you want to stand a chance to win, what I want you to do is pop in the comments the name of our summit, and I want you to let me know who you think should attend with you. So one of your colleagues, someone you studied with, or someone who works with you, or a mentor who inspires you, or someone who you're mentoring and helping, put their name in there and let them know about the summit so that we can invite them, maybe also give them a ticket. I don't know. You never know what we might do at Online Pet Health. So if you want to win the name of the summit in the comments with a person that you want to see attending. Okay, so back to the subject. Michele, you're lecturing at the summit. What are you going to be talking about on our Equine platform?
Well, really about how important it is to integrate functional and structural medicine together. You know, in our fields, we do love to become very isolated as far as what we do. So chiropractors just do chiropractic and they only treat like osteological and neurological things. You know, same with acupuncturists, that we become very streamlined into doing one thing. And the trouble with that is that our patients suffer because not one thing is ever without the other. So structural creates functional issues, functional creates structural issues. Neurology and pain are obviously one of our biggest things that we always want to treat first before we even embark on trying to change the functional and the structural, and really understanding the connection between pain and functional and structural dysfunction, and how it integrates together.
Okay, so loads of things there, like basically connection, right?
Correct.
Which is actually for this year. And also, for me, what you've just said highlights unity between professionals, because it is okay to specialize in your one thing, but if you're working together with the other professionals, then you can bring that integration of looking at the horse from a holistic, point of view. If you're looking through the eyes of the acupuncturist and a massage therapist and a chiropractor and a vet and a farrier, and we all come together, we can then get the best idea of what's happening and to treat it going forward. So the unity is another big topic for us at the summit. We're doing a discussion room on that, where we're going to be focusing on kind of solving some of the problems that we have in our profession at the moment. In some countries, it's a big problem right now, getting to a point where we can actually practice logically. And in other countries, it's maybe less of an issue, but it's always underlying until we get the profession registered and regulated and controlled all over the world, unity is going to continue to be a challenge for us. So join us to discuss that. If you have some ideas on what we can do in our profession, then that's going to be a good conversation. So I'm getting off topic again, guys. My brain is full of summit. It's like all we're doing right now. So, okay, so let's jump a little bit into this topic, Michele. So pain, function, structure, that's your thing. So let's break it down, because to put a picture together, we have to break it apart first. In our equine patients, let's start with structural dysfunction. What does that look like?
Okay, well, let's take a case scenario, because that's always easier to discuss than an actual, enigmatic idea. So let's say your horse comes up 2 out of 5 lame on the off hind. And so we start poking and prodding. We start doing flexion tests. We start looking at hocks, stifles, all of those sorts of things. We rule out a suspensory ligament strain or a deflexor. So we start moving up the chain. So let's say it ends up being a sacroiliac syndrome, okay, where we're not getting proper propulsion through the pelvis because you've got an upslip denominate, which means that the ilium has moved up so that we're not getting proper movement through that pelvis. Now, a number of things are going to happen. The mechanoreceptors as well as the nociceptors are going to hyperfire. So you're going to have an increase in your pain receptors as well as the mechanoreceptors, which basically tell your body where everything is at that point in time. So we get this overload that goes up, basically goes in an ascending pathway to the brain. The brain goes, things are not good here, sends back a reflex, which is basically gets the muscles around that area, specifically your superficial and middle gluteals, your paraspinals, so your longissimus and your iliocostalis, and your hamstrings go into a little bit of spasm. Now, because of the structural issue and how we've got the ilium sitting, the iliopsoas comes into play too, as well as the sartorius, right? So now we're getting a bombshell of muscular issues that are compensating for what's going on a structural level. Now, if we leave that for any extended period of time, we're going to get a knock-on effect as to what's going to happen on a functional level as well as the structural level, because now they're bouncing off each other. So we need to treat the structural, i.e. we need to get that ilium back into the correct position so that we're not having these pain receptors fire, these mechanoreceptors overload, which results in the functional dysfunction. And then we need to treat the functional. But the trouble comes in is if we're only treating the functional, so we're getting rid of the spasms, we're treating those adhesions, we're getting rid of myofascial trigger points in all the above muscles that we were talking about. Great, awesome, the horse is better for a day or two, but we haven't treated the cause of the problem. So we have the same issue coming back and back and back. And your clients are going, I don't know, he was better for a day or two, now he's back to the same position. In the same way as we correct the ilium, but we haven't treated the functional side, now we've got fibrosis, we've got a structural change, we've got myofascial trigger points, we've got adhesions in the fascia that need to be addressed because now we've changed the postural perspective. So these poor mechanoreceptors and nociceptors are still firing, even if we're doing just the functional or the structural. But if we do it all together, we're treating both the pain as well as the functional and the structural, and the body's actually able to heal.
Okay, there we go. So you've now touched on all of it, the function, the structure, and the pain. And obviously, like you can't separate those things from each other. So guys, if you have questions for Michele, now's your chance to ask them. She did write a book on, what is your book's title, Michele?
A Clinician's Guide to Myofascial Pain in the Equine Patient.
Perfect. I didn't want to get that title wrong.
It is. Yes.
It's really good. I'm still reading the canine ones, and when I'm done, I'll switch to the equine. But so if you guys want to really learn the nitty-gritty of it, that's a really good resource. And it also, I mean, we can all be authors. So if there's something you're really passionate about, write about it, right?
Absolutely. You know, there's always, all of us have something to teach. And I think for me, I never ever thought I'd get into education just because I'm very practical. But I find that it's something that we're really lacking in our profession is, as you were talking about, Anabe, earlier, is that integrated response, of everybody working together, because that's when things really work well. So in that sort of case, if the horse is particularly painful, we'd get the vet in, we'd start doing some pain meds, we'd have the massage therapist, we would have the physical therapist working on board, because of course, if we've had something for a while or something is terribly acute, very often it can indicate a dysfunction that is actually a weakness that is underlying that we're not addressing. So very often in the horse world, we'll see things come up over and over and over again. And I can't even count how many times I've heard from clients say, oh, it's his usual thing. Well, if it's his usual thing, we should probably be looking at it and changing it because we're not getting better. So I think, like you were saying, everybody has a part to play, and we can all play in the same sandbox very nicely if we choose to. Here in America, it's very difficult to integrate with practitioners, and there's a lot of separation, unfortunately. But if we all actually just understood what each other did and could bounce things off each other and treat unitedly, that animal would have such a better response.
Yeah, I think that understanding what other professionals have to offer is really important. I don't know if you saw the podcast that Meg did with Leilani Alvarez, which was about a research study, a research survey that she had done looking at the perceptions of veterinarians. And the one of the big things that came across was that they didn't perceive rehab to be valuable. And that secondary to that was that they didn't understand it well enough. So if you don't understand something, or if you don't have some kind of understanding of something, then you don't think it's valuable. And we see that all the time, right? For example, I might not think acupuncture is valuable because, really, what are you doing? You're just sticking needles in there, and it just makes no sense to me. And why would you do that? As an example, I do think acupuncture is valuable, but just because I don't understand something, it's easy for me to discount its value. So that is really our first step, right? Is to understand each other. And I'd love to add to that if we feel that someone doesn't understand us, the first step is to understand them better so that we can then help them to understand us. But, coming from a place of sharing ourselves first, understanding them first, before we force what we're doing onto someone else. And I think that's really important for us to be able to work together, is that we need to see the value in others before they're going to see the value in us, right?
Well, and I think the biggest thing, particularly in the equine world, and I have a very, very long history in the thoroughbred race world and stud world. I think the important thing is like you say, knowing and understanding value in everybody. The other thing is to do what you're good at. So, people are really scared of losing business, and I think if you can make people understand what you do that is effective and you're not going to be stepping on their toes, that's really important. The other thing too is that we're really in the horse world, as opposed to the small animal world, it's a lot more competitive. So yes, our horses are our pets, so to speak, but they're athletes. So in order for an athlete to be completely efficient, it needs a team. So, and that's where the breakdown happens, is everything starts in the foot. So if you've got a good farrier who can understand anatomy correctly and physiology, so that he would understand angles, that makes all the difference, because now the chances of a suspensory ligament are reduced. A suspensory strain is reduced because now we've got better feet, we've got better angles. If we are in a bit of rough footing, it's not going to break them down to the point that they're going to have to be stall rest for 3 to 6 months. So, I think communication and for me, the biggest thing in the the rehab world is really understanding the pain mechanisms, because very often we are so gung-ho to treat that we forget about treating pain first. And the reason why it's so important to treat pain first is the knock-on effect that the pain pathways have. So you may be doing the absolute best thing for that horse, but if you are not treating that pain correctly and having that under control, your treatment is really, to a certain degree, ineffective, because we're not getting the trifecta sorted at the same time. So pain control is really, really important, and that's where you can build your relationships with your vet. It doesn't always work that we can do it on a manual basis. Sometimes we do need holistic or pharmaceutical drugs to drop things down to a level that the body can actually heal. Otherwise, it's always in crisis mode. So understanding that more effectively, and I think that's a breakdown in a lot of our education, is really understanding the pain pathways correctly and where we fit in that pain cascade so that we can be effective.
Absolutely, I agree with you. Having a really deep, like, I can tell you what happens in my sleep, understanding of the pain pathways is important. And also having an understanding of pharmacology, because that's for sure, that's a weakness for me. But the better we can understand how drugs are interacting and working, we're obviously not prescribing them, but we can understand what's happening. The better and deeper understanding it also gives us of those pain pathways and how we could affect them in other ways. And how our modalities would affect that as well. So I think that's really valuable. Understanding the neurological system and understanding our pain pathways is something that we're not as good at as we possibly should be, personally.
No, and I think that's the case. You know, if I look at the different educational bodies that I've certified through, I've had to do a lot of work for many years on my own to really understand the pathways and understand the mechanisms and see it for myself, especially, you know, acute versus chronic. So understanding the brain and how it works, as you know, on a central nervous system front, is really, really effective. So I think when people try to compartmentalize something into one compartment and not understand everything that's going on, that's when we fall down a little bit. And modalities are wonderful. At certain times, they work more effectively than others. And that's where understanding the neurological system and the pain pathways really does make a difference. So, you know, I've had lots of people reach out and go, you know, I've tried this, I've tried that. And I'm like, well, maybe it's just too early, or maybe it's just too late. Like, maybe you need to look at this, this, and this, because this is where we're at right now. And it would be more effective doing that than this. So having a lot of different things in your toolbox is very helpful, because then not everything looks like a nail and you've only got a hammer. So the more we can understand where we are effective and when is super helpful.
And this, you know, this falls again into the deeper or the better understanding we have of the value and the skills of other professionals, the more easily we can say, now you need to go and see this person. Now we need to bring this person onto the team, and help guide the rehabilitation process to be as effective as possible, because we understand what each person can bring to the party. I think that's so valuable. We don't have to be everything. We can't be everything. It's not realistic and it's not necessary. So I really like that. So I think I would like to talk a little bit about chatting to our owners, because when we're looking at the body from this broader point of view, where we're saying each system is interconnected, every small thing has a knock-on effect throughout the body. What we're essentially saying is that, you know, the owner thought that one small thing was wrong, but actually there's like a list as long as my arm of structures that are affected and are now abnormal within our patient. So how do we how do we chat to our owner and take away that overwhelm from what they might be feeling when we come to them and say, these are the things that I've found, and also these are the things that I suspect, and these are the things from my experience and knowledge that we should be aware of. How do you deal with that?
I think the key is really breaking one. No one's impressed by the names of muscles and nerves and everything that you've learned in school. Congratulations, well done. They don't know. So you got to break it down to make it really simple. And I think I often actually get clients to do stuff with me. So let's say we've got a SI issue. I'll block their SI and make them walk around and go, how does that feel? What's hurting? And so they get to actually feel it for themselves and understand. I think the overwhelm comes in when we don't have a plan. I think the minute that you present a plan and you go, this is the problem, this is how we're going to fix it, and this is who's going to be involved, they're like, cool, great, let's go. Because they only want the best for their pet. So I think that's half of the issue is don't get caught up with medical speak. Like, no one's impressed by that, and it makes no sense to them, and you've lost them in the first sentence. So, break it down, make it simple, use analogies. I often talk about the Beyonce butt because that everybody gets a visual, right? Everybody knows what Beyonce does when she dances. So when I talk about it, people are like, oh, I totally get that. Okay, yeah, no, there's nothing going on there. So, like making it applicable to everyday stuff is really important. And having a plan for your clients and go, I'm not 100% sure, but we're going to confer with your vet on this. And we're going to go and, this is my thought process, and taking the drama out of it. Unfortunately, because of the competitiveness of the horse world, there's a lot of drama attached to any kind of dysfunction or lameness. Take the drama away. Just go, this is what we're looking at. This is our time frame. This is our plan. Okay. And they're like, okay, got it. But I think we can all get caught up in the emotion and the drama of it all. And you have to take a step back and really just, even before you go and talk to the client, like formulate that plan. Make it, get people involved and go, look, this is our next step. This is what we're going to do. Bang, 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 bang. This is the time we're looking at, and so on and so forth. Getting involved in the client's emotional energy at that point is completely contraindicated for a good response.
Don't you love it when they come to you and say, I'm competing this weekend, fix it?
No, you're not. No. And honestly, they've got you out because they respect you, and they want the best for their animals. Sometimes you just have to rein them in. And once they understand, I've really, even with top racehorses, we've scratched them last minute just because it's like the short story isn't worth compromising the long.
Yeah, and it's so true. Like, we can, if we're on top of it, we can pick up those areas of overuse or strain before they're an injury. But if they go onto the track or into the ring, and they then put 100% through, 100% of effort into their performance, those structures are not able to continue to hold on, to continue to maintain whatever, and that's when the injuries happen. So scratching them and giving them a break can sometimes just be what they need to not go through a year's worth of rehab or 6 months or never return to sport again. That's the challenge.
It is a challenge, but I think most people are reasonable, and I think if you present it correctly, with the correct intention in mind, and also taking into account that the rider or the owner at that point has put in a lot of work, and it is disappointing, and I completely understand that. But at the same time, you want longevity for your animal.
Yeah. 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 No, exactly. All the work that you put in, if it means that you're gonna ride one more round and then have a tendon injury, that's just, it's not just quit while you're ahead, take a break, and then come back. And then it'll be so much better. So you mentioned that you use a lot of analogies, and we've chatted about some of them before on the small animal platform, but I would love to hear some of the things that you say to your equine owners to help them understand, because there is nothing as valuable to helping them understand what you're trying to say as drawing a picture that they can see. So what are some of the things that you use?
Well, the Beyonce analogy is a big one for me because propulsion is everything in the hindquarter. That's where the engine is. And you see so many upside down horses where everything's in front and they look like a lollipop, or a guy from the gym who forgot to do leg day. So like stuff like that, I talk about a lot because they literally do. You see these horses that look like they're cart horses and they have this skinny little bum behind, which is doing nothing but dragging their legs around, really, because everything's in the fore. So the minute they get that visual in their mind, they're like, oh my gosh. And I make people step away a lot from their horse and actually have a look at them, because very often you've got three horses in one. You've got like skinny butt behind and no top line and chunky shoulder. So, once people kind of get that, they go, oh my gosh, he is a dude who forgot to do leg day, and it's little things like that. And then I say to them, okay, so we want him to have a squatting butt, right? Like that's where all the power is. That's what we want. And it's just making it so much more applicable to in their mind. And it's so funny. I had a client reach out to her I haven't seen in probably like 6 or 7 years the other day, and she's like, just wanted to send you a picture and show you that I don't have a lollipop anymore. So it sticks with them, because if you start getting really convoluted and high hoity-toity with all your medicalese, it just doesn't stay. And I see this all the time, where you spend a lot of time with an initial and you give them all this verbiage and they're completely overwhelmed, and they walk away and somebody says to them, so what did the doc say? I don't know. There's something wrong with his back end. I don't know. And you're like, seriously, I've just spent an hour telling you, but you've got to break it down into something that's really kind of a take-home message and understandable, because you are going to be asking things of your client. You're going to ask for exercises or stretches or TheraBand work or something. If they don't understand the why, they're never going to do it. And making them understand the why is imperative. So that's really what I concentrate on, is having them understand why I'm doing the things I do, why I'm asking them to do the things they do. And once they get that relationship is established, and they will be compliant because they get it.
That's one of the biggest challenges we have, right? Is actual compliance and commitment. Not even just compliance, but that commitment from the owner to say, this is what we're doing for the next 6 weeks. We're going to work together. You need to be on board to be doing X, Y, and Z in between our visits. And there are some really awesome techniques in this, that we've discussed on the small animal platform over the last couple of years on how we can increase our owner compliance. But it's just as much of a concern for us in horses, although I think that because the owners are competitive, they're already spending time training and working with their horses in specific ways, like they have programs that they're following most of the time. It's a little bit easier for them to understand. Are there other techniques that you use to help increase owner compliance for your horse owners?
I never give them more than 2 to 3 things to do, ever. And I never increase their time at the barn by more than 5 minutes, because time is precious. And so and that's always the first question I ask, is how much are you able to do? How often are you able to be here, so that we get an idea that can work in a timeline, and we take the guilt out of it. Guilting your client into something is not helpful. So if somebody says to me, I can only be here 3 days a week, great, this is what we're going to do. This, and this. And because nobody's going to, I know I don't do more than 3 things if my practitioner tells me to do. If you give me a list of 5 or more, I'm gone. I'm like, nope, not going to do it. Don't have the time, don't have the, and I know it's good for me, but it becomes that overwhelm.
Yeah.
So I think starting always with 2 to 3 things where it's simple, and it might be like very, very doable and something they may already be doing, makes them get a lot more confidence in, and they feel a part of the process, but it's no overwhelm. I think managing the overwhelm is really important. We get excited and we want them to do what we just did for an hour. It's never going to happen, ever. So
I agree with you. So take something that they're already doing, that's already in their program, and see if you can adjust or modify that to achieve your goals, so that it's not like a huge change for them. It's not a big adaptation. They can just make small changes and be achieving your goals. I think that's a really good idea. No overwhelm and no drama, and don't get involved in the emotional, aspect of it and the drama. I like that. It's easy to get, I think, especially when you're new, like, in my first few cases, I remember it was so hard to be able to say, something's wrong with your horse. This is what I think it is. Like, already I'm emotional and it's difficult for me, and now I have to help the owner to not be emotional. That was super hard for me in the beginning, super hard. So it's a skill that we all have to learn.
Just don't overwhelm them, because that's why we have the issue with compliance. Like for example, suspensory ligament stuff. Often what I'll do is, as we're coming out of rest for letting it to heal, I'll do some banded work. I'll do some super simple stuff that we're just doing in hand, walkovers, walkover poles, figure 8s, backup, stuff like that they can do all in one go on the ground. It's not complicated. Great. Do that 5 times for me, and then do your thing. Cool.
I like it. Guys, for those of you who have joined us, I just want to say we are running a competition. You should know that on the 14th of November, we are holding our annual summit. So if you would like to win a ticket to the summit, which will be attached to 1 month's membership to our Equine members portal, put the name of the summit in the comments, and also tag someone who you want to see attending the summit. So a colleague of yours, someone you look up to, or someone who you're helping who's new in our industry. Let them know, or let us know about them. And you could win a 1 month membership to Online Pet Health with a ticket to the summit. I have to keep checking myself because I'm going to tell you the name of the summit. So put it in the comments. Okay, Michelle, where were we? I think we were talking about owner compliance, which is very far off of the topic we started on, but I like it. Do you guys have any questions? If you have anything, then just pop it in the comments. I see Megan is laughing at us a bit. And there's someone else enjoying our chat and loving what we're saying about the Vet Rehab team, and that none of us are an island. So I think that's really important. And especially in the equine industry, we are working with so many different professionals. It's better if we work together, use each other. You have trainers for a reason, use the trainers,
And most of the time it's just our ego, really, that gets in the way. And vets get I really do feel for them, because they get the short end of the stick every time. Here in the US, you do an undergrad, you go to vet school for 4 years. That's it. 4 years. And you're expected to know, your clients expect you to know everything from cattle to horses, to cats, to dogs, to gerbils, to birds. I mean, it's not possible. And that's why the stress in the veterinary world is so, so high. And very often I find that that's one of the reasons why people don't want to work with other practitioners, is this fear of being caught out of not knowing. that's okay, because that's how we learn. You know, we definitely don't know everything, and we can never know everything. So everything's a learning opportunity. But I think for a lot of people, the fear of being caught out not knowing is really something very, very real.
Yeah.
And it's unfortunate because, again, if we are not open to including other people's expertise who do know better about those sorts of things, our patient loses out, you know?
Yeah. I don't know if you know about imposter syndrome, but
Of course.
it's pretty much what you're describing now, where we feel like we are not good enough to be doing what we're doing. And so we doubt ourselves. And there are a whole bunch of things that we end up thinking and feeling about ourselves. And it's not a reflection of the truth. You know, we could be very well qualified, have more than enough experience, and be very capable of dealing with the situation in front of us, and still feel like we don't belong there. We're not good enough to be doing what we're doing. We have a podcast on it. So if you feel like that sometimes, if you feel like you're not good enough, first know that it's normal. It is a very human feeling, and we all feel like that. So you're not alone, and go listen to that podcast on imposter syndrome so that you can get a better understanding, an idea of why you're feeling how you're feeling. And that is completely normal. And now we all feel that, and we all have to find a way to deal with it and get to the other side of it. And we have to be comfortable and confident with ourselves if we're going to do the best thing for our patients. And that's not sharing cases, not communicating, not interfering. That does often come from a place of insecurity. It did and has for me, where I haven't been able to communicate with a vet or a fellow practitioner because I feel like I'm missing something and I'm not good enough, and they're going to know that if I speak to them. So just know we all feel that way, guys. So yeah,
and it's okay.
It is.
And that's the thing is, I was talking to a vet the other day, and I was like, I don't know. I don't know what's going on here. Do you know? And they're like, oh, thank God, I don't know either. And I'm like, great, let's put our heads together and try to figure this out. Because the minute that you own it, it's like pressure comes off.
Yeah.
The biggest thing is if you don't own it and you keep on pretending that you do know, if you go down the line, I mean, I honestly, in 17 years or so that I've been doing this, there have been many times where I'm like, I'm out. I don't know, but let's find somebody who does. And we do. And the client will always come back to you. You will never lose that client because you've been honest and you're working within your realm. You're finding them the answers that they're looking for. The worst thing is leaving somebody high and dry with no answers.
Yes.
And out of, a couple of $100 out of pocket, because your pride and ego wouldn't take a backseat.
Yeah, exactly. And I mean, that owner is going to go look for answers. They don't have you haven't given them to them. They're going to keep looking, and then you have lost them. Then they're not going to come back to you because So being upfront and saying, I don't have the answers. Let's try and figure it out. Let me try and see if there's someone else who can help you. That keeps them, even though they're going to go to someone else for this particular problem, they're going to come back to you because you have resources and you have a plan and you can find answers. You can look for them. And that's important. So I think, again, the same thing. Just take out the drama and take out the emotion. We don't need it. Even if it's you who feels that way, me who feel that way, just let it go and realize that we're just human. That's it.
Well, and coming back to our topic at hand, actually, is very often we'll get knock-on issues. So let's say we've got a deep digital flexor issue, and it's very hard to determine. Sometimes high suspensories, deep digital flexors, all of those sorts of things are really hard to diagnose. So we start seeing this shifting lameness up and down, and we don't know where it's coming from. and we get knock-on effects because there's compensation. So this may be a month or so down the line where we've got this grade 1, grade 2 ligament or tendon issue, which is creating other issues further up. You are doing your job by adjusting the sacroiliac or treating the musculature or addressing all of that, but we could be missing that very, very significant thing that we cannot diagnose because there is no heat, there is no swelling. We know the horse is lame, but we can't figure it out. Like, get other people involved, ask opinions. That's when it helps to get the vet to block it out or see what's going on. So, I would say have a really good treatment plan. And if after 2 or 3 sessions you're not seeing the progress that you were expecting, start asking for help, because we can't do that. That's beyond our scope of practice. And being able to identify something and get the correct treatment at the right time from other practitioners is very, very important. And we know that we can't do anything but rest for that at that point. But that's going to heal, and then all of that other symptomatology is going to go away.
Yeah. Okay, I think, Michele, we've had a really long conversation. Guys, if you're listening to this as a recording, you can still enter our competition. I'm not going to announce a winner now. I'm going to look at the comments in a few days' time. So tell me the name of our annual summit on the 14th of November and let me know who you want to see attending, and you can stand a chance to win. And I'll let you guys know who wins in a couple of days. We've already had 2 winners, someone on our hydro platform and someone on our small animal platform. So 1 more equine membership to give away, and then we're going to have to think of other ways to give away summit tickets in the weeks ahead. So yeah, Michele, thank you so much for the chat. If you guys do have questions for Michele, put them in the comments and I'll get them to her, or I'll get her to come onto the Facebook page and answer them for you in the comments. And yes, so thank you so much.
Thank you for having me. Have a great day.
Bye, everyone.
Bye.